Hi there everyone and welcome to our VR lesson today. Today's VR lesson is on the abdominal wall. So we'll start by having a look at the anatomy of our abdominal wall. So here my probe's actually centrally placed in the epigastric region. Now looking at my pointer, what we can see here is our right rectus muscle, as you should all remember from relational anatomy. So this is our right rectus muscle, and it's actually a fusiform shaped muscle that extends all the way down from your pubic symphysis up to your zippy sternum. Now we can see that in transverse, and we can see the striated pattern that it actually makes. And looking at it in longitudinal, you can see the fibrillar pattern of this muscle. Now, as we know, there's two rectus muscles. There's the right rectus muscle. Remember, this is the right side of our screen, and this is the left in our transverse orientation. So we've got the left rectus muscle here, as we can see. And this forms what we know as a six-pack, or some people have an eight-pack. And these are the muscles that we use for sit-ups. Now, when we're looking sonographically, what we're seeing is our skin surface. So we're seeing, I'll just zoom that up for you. So we're seeing the skin surface here. We're seeing a dermoid, or our dermal layers. Then we've got Camper's fascia, and we've got Scarpa's fascia. So Camper's fascia, Scarpa's fascia, we can't see the distinguishable, they're undistinguishable in ultrasound. Then we've got our superficial layer here, as we're seeing. Now we've got our linea alba. So this is our aponeurosis that actually joins the two muscles. So this is linea alba. And quite often this is defective in some humans, and therefore this gives way to what we know as a hernia. So quite often, or we can get divarification where this in pregnant women actually extends out dramatically, and many women need actual surgery after having childbirth because their rectus muscles actually separate so much. So here we're seeing our right rectus, left rectus, our linea alba, and we can see some peritoneum. We can see the parietal peritoneum, and we can see the parietal peritoneum here peristalsing underneath. Okay, so shimmering away there. And what we're going to look at today, can we see this bowel? And we can see the dirty shadowing. So this is called dirty shadowing when we're seeing bowel, and we're seeing our luminal layers here nicely. So we can see the alternating layers, as we know in our bowel lecture. So going from echogenic to hypoechoic, as we can see here, and that's our bowel shimmering underneath, causing this dirty shadowing. Now moving laterally, what we can see here is our external abdominal wall. So what we're looking at is our abdominal wall. Now if we remember from our relational anatomy, we have the three layers. I'm just going to heel toe the probe here so that I can flatten it out. See how I can make it an oblique? Or if I come around and I push one side of the probe in, I can heel toe the probe so that we can see those layers better. Now what we're seeing here is our dermal layer, Camper's fascia, Scarpa's fascia, superficial layer, and what we're seeing here is our external oblique muscle. Now remember, it sits in a V-shaped configuration, and the muscle underneath it is our internal oblique muscle. Now it sits in a cross hatch section for strength. So remember, we use these two muscles for our internal external rotation for strength, and underneath this we have our corset muscle known as transversus abdominis. Now this has varying names depending on what textbook you're looking at, okay? So it can be called transversus abdominalis muscle or transversus abdominis. There's many different variations of the name. So if we look here, we can see the parietal peritoneum shimmering away underneath. So we're in a transverse view on our abdomen. So if we were to use our body, we can see we're using our MSK superficial preset. We're using the IU22 on this preset. Up here we're seeing our thermal index and our mechanical index, and you'll learn more about those in physics of ultrasound. Now looking at our external abdominal wall layers, if we rotate the probe into a 90-degree view, now we can see the fibrillar pattern of those muscles. And now what we use, now when assessing these muscles, we actually look for this fibrillar pattern and the integrity of these muscles. Now, many places that can actually become herniated include the linea alba. So we have a right rectus, left rectus. So we can get herniations, particularly as I'm scanning inferiorly down to the umbilical region. So to scan the umbilical region, quite often we'll use a standoff pad, which is a jelly pad, or we'll fill the umbilicus with gel. So quite often this can be an area of weakness where the parietal peritoneum and some bowel can actually push through and force its way through and become an umbilical hernia. Now, this is very important, particularly in cases of strangulation. So strangulated hernias can actually turn cancerous and can turn bad quite quickly. So it's very important that we look for that. So what we're going to get you to do, patient, is push your tummy out, and we'll just see how much the peritoneum moves. So push your tummy out, and we can see with straining how if there was a defect here, the peritoneum can push through and actually induce a hernia. However, in this patient, it's quite intact. So we can see the dropout from the umbilicus here, or the belly button, and quite often we have to angle either side. So even turning in a longitudinal, angling underneath the belly button, quite often to look for umbilical hernias. Now, another region of prominence for hernias is on the lateral aspect of the rectus muscle and the external abdominal wall muscles. Now, just in here, sometimes that's an area of weakness as well. So if we get the patient to push the tummy out, and we can see quite often if there's a weakness here, this is known as a Spigelian hernia. So that's another area that sometimes we actually have to investigate. So just looking back at our rectus muscle, now what can actually go wrong with the external oblique? Why do we do sonography of this area? Now, there are many reasons. We look for lipomas, which are fatty lumps, and in some disease processes it can be Derkham's disease, which means painful lipomas. We can look for foreign bodies. So in the case of a foreign body, such as a knife wound or a timber splinter, what will be expected of us is to measure how far from the skin surface. So this is a very important aspect. So we'll freeze the probe, and we measure from the skin surface down. Okay, so for the penetration, and sometimes you might have to mark on the skin where that foreign body has actually infiltrated, and if it's a piece of glass or timber, how far in it actually penetrates and on what angle. So this is a very important measurement, and you must measure that in 3 planes. If you're seeing a foreign body, you must measure it 2 in the longitudinal plane and then 1 in the transverse plane. So that's very important also. Now, another thing that we may look for in the superficial tissues is desmoid tumours. So desmoid tumours and also secondaries are quite rare. However, I have seen in females endometriomas. So at the surface or superficial layers, I have seen endometriomas seeding through the pelvic cavity, and also quite superficial to the abdominal wall. So other things that we may look for, apart from hernias, foreign bodies, desmoid tumours, lipomas, and other things such as urinomas. So just say the person's in kidney failure, we may have to look for pockets of fluid collection, etc. So when scanning our abdominal wall, just be mindful that you can change your preset, you can use harmonics. So turn harmonics on because it changes your dynamic gain, which you'll learn about in your physics. And also, very important, to activate your colour. Remember, your colour is directional, whereas your colour power angio, which we can't see much of there, is not directional. However, it's extra sensitive. So particularly when you're looking for a vascular supply or inflammation in a foreign body case, activate your colour and your power, and also, if you need it, activate your Doppler. So that's it for our VR lesson today. Thank you very much for joining me.